Well, thank you for joining me. My name is David Kading, and I am super excited to be here with Dr. Karen Lee. We are going to be talking about some papers, and we really, really love what the American Academy of Optometry's Foundation Clinical Podcast Series does by deep diving into these topics. If this is one of your first listens, make sure to go and check out the whole series. Today, we're going to be talking about safety and efficacy. Those are two really, really important things when it comes to treatment for our patients. When a new medication comes out, who cares how efficacious it is if the safety is a problem, and who cares about the safety of a drug if it's not efficacious? This is a topic near and dear to your heart. Karen, tell us a little bit about you, your background, and why Demodex is such a big part of your life now.
Yeah, so this is a big part of my life now because the last 9 months I've actually joined Tarsus as their senior medical ambassador in the Texas, New Mexico, and Louisiana area. But I'm really glad to be here because, at my in the root of my heart, I'm still an academic. Prior to joining Tarsus, the last 6 years, I was at UHCO teaching, and I love the science.
Yes, yes, and big nerd like me, which is what I love. All right, walk us through this paper. Tell us the title. Tell us what we need to learn. This is a meta-analysis. Review for us. What is a meta-analysis?
Yeah, okay, perfect. So the title is Efficacy and Safety of Lotilaner Ophthalmic Solution 0.25% in the Treatment of Demodex Blepharitis, a Systemic Review and Meta-Analysis. And I love that you asked me what a meta-analysis is, because one of the things I always ask myself is, what am I reading and why am I taking the time to read it? So a meta-analysis is actually they look at randomized controlled studies, and you really consider a meta-analysis as the highest level of peer-reviewed scientific evidence available, because they are going to find an objective way to scientifically analyze and combine all of the different results from all of the possible studies that we are constantly flooded with on PubMed, right? And so by analyzing all of that and putting it together, we hope that it will help learners extract more accurate, better quality data, if that kind of helps with why I chose.
Yeah, yeah, it's a study that reviews studies, right? Looking at the whole analysis and how do we really put this together in a meaningful way for across many different studies on one particular subject, right? Is that kind of how it is?
Yeah, exactly. And
Yeah.
so, I mean, to take a moment to just level set Lotilaner, it's a antiparasitic. It's the active ingredient in Xdemvy, and it's very recently FDA approved. What's kind of wild is there's actually been 4 independent meta-analyses papers published already around this molecule. And if you look at the studies that they are analyzing, those 4 studies are Tarsus sponsored studies, and they were part of the data that we gave to the FDA to help um, convince them of, approving this medication.
Yeah. So why is this topic important? Why do we need to really dig into it? Talk to us about the signs, symptoms, prevalence of Demodex, and then just weed right into that on the mechanism of action of lotilaner.
Yeah, so we care about Demodex, and I think we all should really start thinking about Demodex because this is a condition that's much more common than we realized. We had a Titan study where we looked back at 6 different ophthalmology and optometry practices. We did a retrospective look back at their charts, and any patients that came in that had a slit lamp exam performed, we said, how often did you note the term or see collarettes? Collarettes are the pathognomonic sign for these little mites. You think of them as like the house that the mite kind of created, because it's made of live mites, dead mites, their eggs, and their regurgitated waste. So the moment you see a collarette, you know that there was a mite there. And the easiest way to look for those is to just have your patient, when they're behind the slit lamp, look down for a moment and you scan quickly across the lash base of the lashes. Why this is important. So DB is not a self-remitting condition, meaning if we see it and we ignore it, it's not just going to go away with time. And If we allow it to really become full blown, then you start to see other signs that manifest in terms of ocular inflammation with telangiectatic vessels,
Mm.
conjunctival injection, and you'll start to have even potentially like corneal haze from those infiltrates and maybe even superficial corneal neovascularization, and of course, potentially chalasia and hordeolum as well too.
Yeah, yeah. So how does Lotilaner work here? What's its mechanism, based on this study here?
Yeah, so as I mentioned, lotilaner is an anti-parasitic. And so what it does is it is a mite-specific GABA-gated chloride channel inhibitor. And so when you put this eye drop in the eye, because it's quite lipophilic, it will mix with the sebum. And sebum is what those mites actually live off of. And so once it eats the sebum, that medication gets into their body. And when we block those channels, the mite becomes paralyzed and they essentially will starve to death. And
Mm.
yeah, that's exactly
I
how it,
thought they exploded, but no, they starved to death. Okay.
yeah.
It was something here in the study where it talks about a meaningful colorette reduction,
Mhm.
and that it, played a really important part. Like, how does that work out to that? Like, so we're having starving mites. How
Yes.
does that result in this colorette? Like, tie those two together for me
Yeah.
clinically.
So the messaging is very simple. Because collarettes are pathognomonic for these mites, you're going to look for these collarettes to diagnose, but you're also going to look for the reduction in collarettes to know that there is some type of effectivity that's happening with the medication. And if we look in literature, Gao says clinically meaningful collarettes, when you have 10 or less collarettes, that's considered not clinically meaningful. Once you have more than 10, even if your patient is asymptomatic, we consider that clinically meaningful because now your risk of it becoming an overgrowth and full-blown DB is a lot higher than someone that has less collarettes. And so
Hmm.
hopefully that makes sense.
Yeah, in this meta-analysis, every single primary outcome related to collarette cure or eradication, a major change in that. Mite density, that was another term that was talked about. Mite density from baseline. What did we learn about that?
So mite density, to be enrolled within the studies, we actually would target lashes that had collarettes and we would pluck them and put them
Fun.
on a little like a little slide and look under a
Hmm.
microscope. And patients had to have more than 1.5 mites per eyelash to be enrolled. And at every visit, we would do the same thing, target an eyelash that has a collarette, pluck, and we had professional mite counters that would count the number of mites that they saw. And with time, you start to see, even by week two, between the treatment group and the control group, that there's a significant difference between the number of mites you would see per lash follicle.
Yeah, that sounds like a great thing to put on your CV,
Yeah.
mite counter. Now, Now, once redness is there, I think about it, it's there, right? Telangiectasia and so forth. But they also spoke about erythema cure.
Yes.
That's a little striking to me.
Yes. So erythema cure, when we were including people in the study, everyone had to have at least mild lid hyperemia. And
Hmm.
that was something that we kind of followed throughout the 6-week course. And if we kind of dig into it, your patients either had grade 0 lid erythema or they didn't. That's why it's more of like a risk ratio type
Oh,
of
I see.
figure in this. And what we see is that in all of the studies, the erythema cure is favored towards the lotilaner group, meaning that the
Hmm.
lotilaner group just had a better likelihood of having lid erythema cure than the control group.
Yeah, I guess I'm asking this a little bit for my patients and me as well. And maybe the study pointed to this is how
Mhm.
long did the data suggest that it takes for a treatment to take full effect for patients?
Yes. So if you look at our label, they will say, you should use XDEMVY 1 drop twice a day for 6 weeks. You want to separate the drops by about 12 hours if you can, and you want to wait 15 minutes or so before you were to put a contact lens on. And that's the data we have. We have the patients using the full 6-week course. If you
Mm-hmm.
dive into the individual visits, you
Mm-hmm.
actually start to see a difference at week 2. If you kind of look at those graphs again in this paper, they do have data from week 1,
Right.
but the week 1 data doesn't really skew either way. And I think it's because it's just too early for the medication to really have any effect. But if you start having patients come back at around week 2, based off of the Saturn FDA clinical trial data, you will start to see already that there is a significant improvement in collarettes, mite eradication as well too.
Yeah, yeah. I've fasted myself for a long period of time, and at 1 week I'm still living. It takes a little while to kill a bug when it's starving. So 1 week we're seeing that there's not a major difference. But
Mhm.
according to this and other studies, we're seeing that maybe after 2, 3 weeks, and if I remember right, your indication is for 6 weeks of treatment. And
Yes.
so we're eradicating everything that is alive, but also anything that gets born in that time period,
Yep.
I presume, right?
Yeah, I love that you brought that up because the medication does not work on any eggs. So the life mite cycle or the mite life cycle is 2 to 3 weeks long. So any mites that are born, we're hoping to catch them maybe in like the second half so if you have patients where the compliance is questionable, you really want to urge them, like, please do the full 6 weeks.
Right. Yeah. Yeah. No, I have had some patients who they just used it for a short period of time and they're like, I don't know. And I'm like, there's a reason why we have it using it for 6 weeks. This was a great paper. I mean, obviously, we could talk about this for a long time because it reviews a lot of different data. Anything that we haven't hit on that you thought might be worthwhile to touch on with this paper?
Honestly, I would say meta-analyses I feel like are not that common. And all 4 of the meta-analyses that have been published are kind of very resounding in terms of saying that Lotilaner is quite effective. We didn't really talk about the safety, and so I do want to mention
Thank
that
you.
in
Hmm.
terms of adverse events, again, doesn't really skew towards the treatment group or the control group, but if you look at the label, 10% of your patients will have a little bit of burning or stinging when they instill the drop, and less than 2% will have SPK or hordeolum chalazion. Just keep that in the back of your mind. And hopefully, all of this data is, again, just encouraging. So you can use this data to kind of help guide your clinical decision making when you see these patients and decide whether or not to treat them.
Yeah. Yeah. No, yeah, thank you for touching on that. I did miss reviewing that with you. And there's just I'm looking at the paper as we're talking, there's just so many things, so much great information in this. I'd encourage anybody who wants to start diving into the research on this. This is a good place to start. This is a good starting point of a meta-analysis, reviewing a bunch of different papers. Dr. Karen Lee, you're fantastic. Thank you so much for sharing your insights with us. We really appreciate you being here.
Yeah, thank you for taking the time to hang out with me, Dave. Have a good one.
Absolutely, my honor. And thank you for hanging out with us on the American Academy of Optometry's Foundation clinical podcast series. We're sure really excited to get to share this insight with you. We learn a lot in the process, and hopefully through our other episodes, you'll learn a whole bunch as well. Thanks for joining us, and we'll see you next time.
Bye.